All right, let's jump right in. You know, when you think about medicine, you probably picture a doctor's office, right? One patient, one problem at a time. But what if we could zoom out? What if we could treat an entire community all at once? Well, that's exactly what we're talking about today, how we're building the next generation of public health leaders who are doing just that, taking what they learn in the classroom and applying it directly in the heart of our communities.
In this quote, this really gets to the core of it all. It's the mission statement. The goal is to empower people to tackle our biggest health challenges head-on. And pay attention to those words prevent, manage, and overcome. It's not just about treating anymore. That's a huge shift in thinking, so let's keep that idea in our back pocket as we go.
So, before we get into all the cool, high-tech stuff, we gotta lay the groundwork. We need to understand the foundation. And it all starts with a field of study that looks beyond just you and me, to focus on the health of everyone.
And that field is community medicine. This is a total game changer in perspective. Instead of just asking about my health, it forces us to ask about our health. It's like zooming out from a single puzzle piece to see the entire picture, to see the patterns, the risks, and the opportunities that affect a whole population. This is the very bedrock of public health.
But here's the thing. The world is changing, and fast. And our health challenges, they're changing right along with it. The old playbook, well, it just isn't always going to cut it, which means we need a totally new kind of leader for this new era.
I mean, just think about it. We're dealing with everything from global pandemics to chronic diseases that are deeply woven into our daily lives, our environment, our economy, even our technology. To solve problems this complex, you can't just have a doctor. You need a leader who can see that big, messy picture and know how to navigate it.
So, the big question is, how are we equipping them? Well, let's just say the traditional doctor's bag is getting a serious 21st century upgrade. Let's take a look inside this new digital toolkit these future health leaders are going to have.
First step, digital health applications. We're talking about mHealth, which is basically healthcare right there on your phone. Then you've got electronic health records, or EHRs, which let doctors share critical information in an instant. There are these incredible public data dashboards that give us a real-time snapshot of a community's health. And yeah, even the Internet of Things, your smartwatch, your fitness tracker, all these devices are constantly gathering health data. Put it all together, and it's like you're creating a living, breathing map of a community's well-being.
And then you bring in AI. And this isn't some far-off sci-fi concept. This is happening right now. We're talking about using AI to actually predict a disease outbreak before it even starts, using it to figure out the absolute best place to send doctors and medicine, and even using AI chatbots to give people instant, reliable health advice. It's all about getting ahead of the problem, you know? Being proactive instead of just reactive.
Okay, so having the coolest tools on the planet is one thing, but how do you actually shape a student into a leader who can use them to make a real difference? Well, it's not magic, it's a very deliberate, very structured process. Let's see what that journey actually looks like. It really is a journey, a clear path to leadership. It all starts with a cutting-edge curriculum, of course, but just as crucial is that one-on-one mentorship and academic guidance. And finally, students are guided through their own research, so they learn not just to read information, but to create brand new knowledge that could actually save lives. You're building their capacity, piece by piece.
All right, so we've got the leaders, we've got the tools. Now for the most exciting part, right? How do they take all of that raw data and turn it into real, meaningful action that actually makes people's lives better?
This is where the magic really happens. They learn advanced epidemiology, which is basically the science of being a disease detective. They're using powerful coding languages like R and Python to dig through mountains of data to find hidden clues. And with GIS mapping, they can create actual maps that show where health problems are popping up and help figure out why. It is literally like being a detective for an entire community's health.
And I know what you might be thinking. This all sounds super high-tech and abstract, but it's brought right back down to earth with exercises like the family study. This is where students take all those fancy skills and apply them at the most fundamental level we have, the family. They get to see with their own eyes how things like income, environment, and social factors connect to health. It turns all those abstract data points into a real human story.
And that brings us to our final and maybe most important question. When you have leaders trained in community medicine, armed with AI and incredible data skills, and all of it focused on real-world problems, what does that data-driven future of health actually look like? Well, it looks like a future that's more predictive, way more efficient, and, most importantly, a future that's focused on keeping all of us healthy